What really happened in a woman's brain during her menstrual cycle?
Woman's brain during the menstrual cycle changes because of the effects of the hormones. 70% of African women have fibroids. There is a genetic component to fibroids in African women. I was pregnant. I couldn't bear the smell of my husband. Discomfort during intimacy with women depends on their age. It depends on whether or not there has been time taken to arouse them. It also depends on whether there are underlying problems.
Senior Consultant Obstetrician and Gynecologist, Fellow of the Royal College of Obstetricians and Gynecologists, and a trailblazer in fetal maternal medicine, Dr. Mariam Awatai. She's a woman whose life's work revolves around one of the most sacred things on earth, the miracle of life.
10 to 20%, in fact, I would say 20 to 30% of women go through postnatal depression. Some are lucky, they get out of it with support, with help. Others are not so lucky, they end up in suicide. The most important thing a man must know about a woman's body is that we are very hormonal, very cyclical. Sometimes you will find husbands that come to the clinic to see me. They'll say, oh, it's the time of the month. Sex education actually is really important. It's not just about sperms, eggs, and fertility and contraception and all of this. It shouldn't be about that. Men should know about puberty. Men should know about what happens to women between the ages of 18 and 35 when they are most fertile.
It's kind of seen as we had a conversation when a man is so curious about understanding the woman's body.
We have to move away from making women feel embarrassed to talk about what they're going through, whether it is painful periods, whether it is endometriosis, inflammatory problems that can occur. Having people understand that this is what she's going through and what she's going through isn't abnormal. It's actually natural. We need to normalize this hormonal cyclicity that occurs in females.
We live in a world where men talk about women but rarely take time to understand them. They admire her beauty, yet know little about the body that carries her strength, her pain, and her story. From hormones to emotions, from fertility to desire, there's a whole world inside the woman's body that most men were never taught to explore with respect, curiosity, and empathy. In this episode, we peel back the layers. We talk science, emotion, and the silent truths women wish men understood. This is not just another conversation, it's a lesson every man should hear. And to talk about this, we have veteran and distinguished Dr. Miriam.
Thank you, Ken.
How you doing, Dr. Miriam?
It's great to be here. Really, it's such an honor, really. Such a privilege. And what a topic.
Yeah.
This is going to get exciting.
To be very honest, this is a very important conversation for me.
It is.
And I think every man should listen to this because we grew up not actually knowing and understanding the woman's body. Okay. And that's like a very important conversation. I will have the veteran to do justice to that.
Absolutely. So I will do my best.
Amazing. So how has it been for you so far in the UAE?
So thank you, Ken, again for inviting me onto this wonderful podcast. And I am a consultant obstetrician and gynecologist. Okay. And I've been practicing for more than 33 years now, actually getting on to my 34th year. I won't tell you how old I am. And it's been amazing, really. I spent about 21 years in London, 7 years as a consultant in obstetrics and gynecology. I did all my hardcore training. I specialize in high-risk obstetrics, in minimal access surgery. And I really, really feel blessed and privileged to have had the opportunity to spend my career looking after women and their families because I actually love doing it. Okay. I arrived in the UAE in 2012 and worked first in Abu Dhabi in Corniche Hospital, which is the largest maternity hospital in the UAE. We're a tertiary referral centre where all high-risk pregnancies, high-risk difficult gynecology cases come to. And it was an amazing 4 years at Corniche, very similar to the NHS actually. And again, exposed me to a lot of maternal health issues in the region, in the UAE and beyond, and really, really allowed me to hone in my skills. I'm heavy in teaching as well, so I was head of governance and I was also an associate program director for the Emiratization program in the UAE, in Abu Dhabi, where we help to train more than 50 odd postgraduate doctors in obstetrics and gynecology, coming through our hospital and learning and developing their skills. I then headed multiple departments in Burjil, in Suleiman Habib. I came to Gargash Hospital, I came to Dubai, worked again for about 6 or 7 years before starting my own practice, where I founded and I am the medical director for Dr. Mariam Awatai Clinic, which is based in Dubai Healthcare City. We are a women's only clinic. We look after women aged 11 to 60 and beyond.
Amazing.
So I am able to tell you a lot about women, what women go through all the stages. Really, we call it menarche. Menarche is when they first start having periods, when we start having periods, all the way to postmenopause where the periods stop. And believe me, Ken, there are a lot of changes that men absolutely need to know about. And I think if they did, we'd have a much more peaceful world.
Just a brief question. What are those changes you think men need to know?
Need to know. I think it's, the best way to address that question, Ken, is to look at the ages. Right. Take it from a father point of view. Right. So, 11 years old, a woman, in fact, before that, the girl child. A lot of our traditions will tell us that a man who doesn't have a girl child is actually not a blessed man. You have to have a girl child because our ancestors realized the nurturing nature of women, the understanding that a woman's trajectory, not just her reproductive cycle and not just her ability to have a husband and have children, it goes beyond that. She really is the pillar of her society. If you train girl children and if you support girl women in a community, you will have a highly functional community. So for me as a gynecologist, I will start with the understanding of what happens when a woman reaches puberty. Okay. What happens to them? All right. They go through an enormous amount of hormonal changes. I mean, both from the actual menstrual cycle, we are born with a finite amount of eggs. We have a very short window for fertility. So every baby girl child has only 3 million eggs. That's it. We're not like men. We can't produce more.
Talking about fertility.
Yes.
I think we're going to go further.
We're going to go a lot of it. Of that. It's a whole conversation, Ken.
Yeah, because we would try to understand the menstrual cycle here.
Absolutely.
Try to understand fertility.
And the effect. And what is a man going to do? He has a daughter who's pubertal. How are you going to handle that child? Exactly. How does that child cope in the home? She's probably having painful periods, painful cycles. She's probably not understanding how her body is changing. Her father's probably either too busy or too embarrassed, or her mother might not even have explained it to her. And she's got all the information that she gets are from books, social media, and peers. This is not enough. I really do believe that the men in the household, both her father, her brothers, her uncles, they need to understand what a female child goes through pubertal wise. The effect of females and the changes that occur in females is actually throughout their life cycle. And when you ask me the question, what should men know? Men should know about puberty. Men should know about what happens to women between the ages of 18 and 35 when they are most fertile. Men should know what happens to women from 35 to 45. And men should know what happens to women from 45 all the way to 60 postmenopause. I think if we could look at these different stages, because they are all different, it would be really educational.
Dr. Miriam, with over 3 decades of practice and experience, you've helped, women bring life into the world.
Yeah.
You've also helped them understand their own bodies.
Yes.
So what's that thing that you think most men
Yeah.
must understand about a woman's body?
Honestly, I think the most important thing a man must know about a woman's body is that we are very hormonal and we are very cyclical. And our hormones are not
When you say cyclical, how do you mean?
What I mean is, if you take a 30-day month, if you take 30 days in a month, in that month, a woman, maybe the first 7 days of that month, she will be in a lot of pain and discomfort. She will have her hormones, her estrogen levels, her progesterone levels are quite erratic. They're rising rapidly.
Okay.
When you get to the middle of that month, when she's about to ovulate, she feels a little bit better. She feels a little bit energetic. So the second part of that month, I would say, so the first 10 days is all erratic. The middle 10 days, she's energetic. She's able to take on so much. You would wonder, my wife, my girlfriend, she's amazing.
Okay.
And then when you get to the last 10 days of that month, her hormones plummet again. And she's feeling out of sorts, distracted. And you're thinking, who's this woman? I don't know you. So I think if men can understand that women are hormonal and we are cyclical, and that some of the things we say and do are sometimes based on this physiology. And this physiology is important physiology, because if we didn't have this physiology, we wouldn't be able to be who we are. So it has to happen.
So is it fair to say that
in
a month, 30 days,
yes,
right? A lot of this happens in a woman's body.
Correct.
That are cyclical hormonal.
Correct.
And tactical, like you said.
Correct.
And she exhibit a lot of things in that 30 days.
Correct.
So her man is supposed to understand that for the 30 days,
correct,
she's going to be differentiates.
Absolutely.
Amazing.
I think you put it so succinctly. This is the perfect way to describe it. You've got one woman with multiple hats on. And these hats are not bad hats.
So at what point do I know what hat she's on?
Exactly. So it's a very good point. So one of the things that is really important actually is communication.
All right.
I really do believe that if men could just openly communicate with women, not this idea of saying, oh, it's that time of the month. Sometimes you will find husbands that come to the clinic to see me. They'll say, oh, it's the time of the month. My wife is, I have to. No, it's not. It's not that because you think she's premenstrual or you think she's hormonal, that she's hands off and you're going to walk away and you're going to not support her. It's that particular time that you need to provide more support. I think that women require a degree of support when they are premenstrual, in particular, when the hormone levels have crashed.
Okay.
They really do need. You will find women change in so many ways. In fact, sometimes they are misdiagnosed as being either depressed, or they are misdiagnosed as being bipolar because of severe PMS, premenstrual syndrome. And if husbands didn't switch off, or partners didn't switch off, or men, or even people in the workplace didn't just say, oh, it's just hormonal, ignore, but actually try to find out and communicate and get her some help, I think we'd have a much better better outcome.
But you said something about men giving their women that support.
Correct.
You can only give that support when you actually know what's happening.
Correct.
So from your experience, why do you think even educated men know little about a woman's body? Because if you don't know about a woman's body, obviously you cannot.
You can't. Absolutely. And I'm so glad you touched on this question, Ken, because, my experience as a gynecologist, as a teacher, as a tutor, as a lecturer in obs and gynae, I see the absolute absence of education from primary school, from secondary school, from at university. This so-called sex education, it's a drop in the ocean. It's not actually taught properly. It's taught.
You actually think so?
Yeah, I believe so. In fact, I've tried to rewrite the curriculum in my children's primary school when I was in England, to make them understand that sex education actually is really important. It doesn't even have to be taught together. It doesn't have to be taught, you can separate the girls, you can separate the boys, but you have to be, you have to make them understand that, the importance of cycles, hormones, support, what to do for the women if they are feeling this way, what the men should do if they are feeling this way. And it's not just about, sperms and eggs and fertility and contraception and all of this. It shouldn't be about that. It should really be about a more holistic approach of how do you handle, how is a woman's body, how does a woman change as she goes through the cyclical pattern? Okay. This is basically it. And the point is, our societies are changing as well, Ken. We used to live in communal societies, right, where we didn't even have to have textbooks, where grandmothers, 3 generations could be living in the same vicinity. So grandparents, aunties, uncles, older sisters, older brothers, lived together. And so they helped to pass this knowledge of, this is how to handle your wife, this is how to handle your daughter, this is how to handle your child. All of this type of thing used to be handled even before we had, the research and the evidence that went with the female body and the female cyclicity and the female hormone response. But we are now living in more isolated communities where you have a young couple, husband, wife, having stressful jobs, trying to cope with jobs, living, the problems at home, the difficulty of, just getting forward every day.
So is it also fair to say that because of the way we are now in the world, or the way the society is now, makes men to be absent or unaware or pay attention to their women's bodies?
100%. I constantly say that the challenge of the female is the challenge of her hormones, the challenge of her environment, the challenge of her social structure and her social expectations, the challenge of just having people understand, that this is what she's going through, and what she's going through isn't is not abnormal. It's actually natural. We need to normalize this hormonal cyclicity that occurs in females. It needs to be normalized. It should not be a situation where because a patient is suffering from mild to moderate PMS, it's like, oh, go see a psychiatrist. This is not what it's about. It is it is there for a reason, actually. Okay. If you look at the anthropology, if you look at, how we all developed like this, females were developed primarily for reproduction and primarily to nurture their kids. Men were really, it was all about, defense, and it was all about protection, provision. Absolutely, and provision. These were the natural roles, and that's how we grew, and that's how our functions developed in order to do this. So I really think that we have to move away from making women feel embarrassed to talk about what they're going through, whether it is painful periods, whether it is endometriosis, inflammatory problems that can occur that make their periods worse, fibroids, where lots of women, 70% of African women, for instance, have fibroids. They're working with fibroids. They're having
Why do you think 70% of African women have fibroids?
Oh, it is a natural incidence, honestly. It is something that research does not understand why the preponderance for fibroids occurs in Afro-Caribbean women, but we believe it is hereditary. We believe that it is inherited.
Genetic?
It's genetic. There is a genetic component to fibroids in African women. And it can happen in other women as well. What I'm trying to say is that benign gynecological problems can be occurring as well as the baseline problems that are occurring in women, just, on a regular basis. And they have to cope with this. And they find it even very difficult to talk about it. And if they go off sick for it, they are challenged in their workplace and they are challenged in their home environment. So the whole thing just becomes a little bit more difficult for women to actually even talk about the problems that they have or seek help.
Doctor, you said something in your earlier explanation about men being there to support, their women and understanding their home mood and, bodies. But don't you think, and this is like an open question, that men or the society doesn't really give men that space to really understand women's bodies? Most times it's kind of seen as a weird conversation when a man is so curious about understanding a woman's bodies, and it's like, so
they say that, why are you doing this? This is not manly.
It's not manly, So the conversation honestly is society giving men that healthy space to truly understand a woman's body?
So true, Ken. So true. And I'm going to start with my late father, Ambassador Damascus, Michael Damascus. He was a diplomat in Moscow. I grew up in Moscow. And my mom used to do a lot of traveling. And she wasn't always at home. And my father, a Nigerian man from Delta State, Asaba, would be the one to wake us up, get us bathed and showered, comb our hair, plait our hair, braid our hair at the time, make breakfast. And it was myself and my younger brother. Take us to school, drop us off at school, go to work, come back, pick us up, and do the whole thing all over again. And he was a diplomat. And he was a traditional Nigerian man. And he truly took on the role of fatherhood like this was nothing. I grew up in a home seeing my father massaging my mother. I didn't really understand why he was always massaging my mom, but he would massage my mother's back, he would massage her feet at certain times of the month. And in retrospect, I'm now realizing she probably wasn't a period at all that time. And that was why she was always having these massages and feeling really grumpy. And my father used to tell us, go easy with your mom, go easy with your mom. So there are men in our society who exist, who take care to try to find out about their partners, who try to support their partners in whatever way they can. And we should empower those types of behaviors. We shouldn't be in a situation where if a man is asking a female person or their, sister, their auntie or their wife or their partner, what's going on, that it's meant to be intrusive. This is too intrusive. You're not supposed to know about it. You are supposed to know about it.
Okay. Because I've actually heard people say, this is like a women conversation. You're not supposed to know.
Absolutely.
It's a woman's thing.
It is not a woman's thing. And we need to move away from that. We need to make it normal to have these types of conversations between both men and women, and make the understanding of each other much better, so that you don't get into these. I'll tell you a story. I'm going to wave off again. Recently, my son took me to a movie. He took me to a movie called One Battle After Another. It was a Leonardo DiCaprio movie with Sean Penn in it, and it was an amazing movie. This movie was supposed to be about a revolutionary who goes out of, sort of goes AWOL, and a dystopian society. But actually, from a gynecology point of view, it was a movie about postnatal depression. I'm telling you, it was a movie about postnatal depression and a husband who had no idea what his wife was doing or going through. And one day, his wife got dressed with her baby that was less than 6 weeks old, handed the baby to her husband and said, I'm leaving you. And the man said, where are you going? And she left. And she never came back. And the whole story was how this man coped with the pressure. Single father, little baby girl, who he didn't know anything or how to handle.
So when you left the space where you saw the movie, the cinema,
Seriously.
What exactly were your thoughts?
I told my son, you need to learn.
Okay.
You need to learn.
Now-
You need to see the signs. You need to see when your wife is going off, when she was crying excessively, when she wasn't sleeping, when she was sleep deprived, when she was telling you, I can't cope with this anymore. And you were saying, oh, don't worry, it's fine. And then you would go off to bed and leave her again. You know, constancy for postnatal depression. This is a typical, sort of, how can I put it? Lack of understanding, really, or lack of
So
awareness.
how can a man understand his woman at that time?
So a lot is knowledge. Forums like this. So there is something called postnatal blues, where a woman will deliver a baby, and for the first 3 to 5 days or so, she will feel down and fed up and really worried. Am I a good mother? Can I manage this tiny infant? This responsibility is too big for me, and all of that. And the husbands are usually very supportive for that first 3 to 7 days, in my experience. But generally, after a week, 2 weeks, if the woman doesn't bounce back, the man's paternity leave is over. He's going back to work. She's got maybe 6 to 8 weeks at home with this young infant, and probably alone without much support. And if the warning signs like the sadness, excessive crying, she stops looking after herself, she stops bothering about her appearance, she's not sleeping, she's not eating, she's either losing weight or gaining too much weight, she's getting thoughts that are dangerous thoughts like, I don't want to continue with this life. Suicidal thoughts.
This happens all the time?
Yes, it happens. 10 to 20%, in fact, I would say 20 to 30% of women go through postnatal depression. And some are lucky, they get out of it with support, with help. Others are not so lucky, they end up in suicide, or they end up like in this film that I was talking to you about, just going AWOL. So, it's signs that when you see signs that are not quite normal, because we don't live in a communal society where the woman's mother is with her, where she has some aunties who will come and say, look, you didn't have your shower today. What's wrong? Why are you feeling bad? Why are you not coping? Let me take the baby. Let me help you. Let me get some help. Come see a doctor. Come do this. All of this is because our societies are more insular. So we are not even picking these women up. But these women exist. And so husbands too have to understand that it's, unfortunately, the responsibility is really on the men to be able to pick this up.
Dr. Miriam, when you talk about men understanding this whole, things that happen in the woman's body at the time, I'll just, paint a picture.
Yeah.
I lost my dad quite younger. So
sorry to hear.
I was actually a father figure for my sisters.
Alhamdulillah, that's very
My
nice.
younger sister, she's married. Okay, they're twins actually. One is married with 2 kids.
Yeah, fantastic.
So when she had her second baby,
Yeah.
because I was growing up, I had to stand up for them.
Yes.
I had to, play that role of the father, support mom, and all of
Absolutely.
that.
God bless
When
you for
she
that.
was, and that was last year when she
Yes.
had her second baby.
Yeah.
During the whole childbirth thing
Yes.
in the labor room,
Yes.
I got a call.
Interesting.
And I got a call from her husband.
Yes.
And I picked up and I said, it was late
Are
because
you
it got
okay?
the time difference. And I'm like, what's happening? And he said, Daniela, she's actually in the labor room. I'm like, okay, she's already ready. She said, no, she wants to talk to you before she gives birth.
Interesting.
And I'm like, what's happening?
That's excellent.
And I picked up the call and I was like, Diana, what's happening? He said, I want to hear your voice before I do this.
Amazing.
Probably. And I said to myself, after the
Amazing.
whole thing, and when she finally gave birth, I said to myself, probably because I've always shown up for her.
Yes. You've been that father figure.
Exactly.
Absolutely.
So I've shown up for her. So this brings to bear the question I was going to ask
Yes.
about how early, in terms of age, should men be taught about understanding a woman's body. I took time from my 17 to understand what exactly happens.
Yes.
I was there for my sisters. I got them pads.
Yes.
I knew, okay, I had to, because sometimes my mom was always working, so she was barely at home.
Excellent.
So I understood certain things about a woman, but
Absolutely.
though some were still vague. So to the young man watching this, or to the parent watching this right now,
Absolutely.
at what age should young men or should boys be taught about a woman's body?
Okay. So can I just say that it should start from the time that the child is being trained. I would say 3, 4, 5, 6 years old. Of course, you're not going to expose the child to, age inappropriate material. But even young children, as young as 5, 6, 7 years old, they should be able to understand my sister is my sister. I want to protect her. I should be around my sister. I should look out for her. When they realistically when they are 11, I would say around 11, boys tend to be pubertal a lot later actually, so they would experience puberty around 15 to 18, and they can go up to 20 actually, whereas girls are pubertal a lot earlier, from about 11 to 13. I would say they should be slowly introduced to the fact that girls and boys are different. You just fundamentally different. Okay. And it's the world we live in is changing so much that these differences are being blurred to a certain extent, and that's maybe another podcast completely. But we are born biologically different, and we do have biologically different needs. And I think that this has got to be explained in a very non-judgmental way. Let the boys understand the girls will have periods. They will have hormones. They have hormones that go up and down, unlike your hormones that stay the same. When it's up, they're okay. When it's down, they feel a little bit down. Support them. You as a boy, your testosterone levels are going to be nice and steady. You can explain to them that when they're having a period, they're tired. They may get a little bit irritable, but this is normal. You can explain to them that the weight that they put on, for instance, we haven't even touched on the sort of weight differences. So if you see a brother and a sister growing up, they could both be nice and slim and everything else. And suddenly the girl gets to puberty and she puts on so much weight and her brother remains lanky. She gets body problems and body image, starts to think, oh, what's wrong with my body? What's wrong with this? This is normal. Women will put on weight, and they will put on weight around their hips, around their chest. They will become different in appearance. This is normal, and it is for a purpose. It is for a reason. It all comes back down to our ability to childbear, pregnancy, lactation, how we breastfeed, how we have to store fat in the right places, how we have to have estrogens in our fat. So these little things that you can just explain so that kids don't grow up feeling like you've just mentioned to me, this is a girl thing. I don't want to know about it. This is a boy thing. I don't want to know about it. No.
Dr. Miriam, you said something a while ago about, the puberty stage, the stages from puberty to menopause. And I was just thinking, what are those changes that men should actually understand when women are going through these changes in their bodies?
Okay. So the obvious ones they can see, the child is changing. She becomes from a simple child to getting, her breast development becomes more, her hips become wider. You can see that she's changing into a young woman. Everyone can see that. That is easy. The hidden ones are the hormonals and the cyclical pattern that we were talking about. From the ages of 18 to 35, this is going to be even more exaggerated. You will find men must be aware that it's not just about, seeing a beautiful woman or seeing a woman in her between 18 and 30 who has blossomed into what their idea of a beautiful woman is. There's much more to the physicality. There's much more to it. It's a time where cycles tend to be regular. So her cycle pattern, she begins to understand them a bit better, and she's in more control over it. You will find that women aged 18 to 35, they know when they've got PMS, and they start taking precautions so that they don't affect the rest of the family. Either they exercise more, or they take some vitamin B supplements, or they go and see a doctor. They take much more responsibility between 18 and 35 to compensate for the hormonal cyclicity problems. But there are other factors as well. We are naturally, hardwired as women to be thinking of fertility between 18 and 35. So whereas a man might not be thinking, I want to settle down when I'm 25, 24, 20, a man might say, I'll settle down when I'm 30 or 40. A woman is beginning to think about a lifetime partner. So even the relationships women have at that age, they are more relationships to settle, to procreate, to have a child, etc. And of course, our environment, that's why I was telling you about the challenges. The environment can sometimes distort that. So, in my career, for instance, and in medicine, it's very difficult for medical females to, in the middle of their careers, when they're trying to do their postgraduate studies, to suddenly say, stop, I'm going to get married and have babies. So this also produces additional stress to women. And so when you add that additional environmental, social stress between the ages of 18 and 35, sometimes, if you're not lucky, you'll find women who are just very anxious, very difficult to be around, who, men, for whatever reason, might think, this is not for me. She's aggressive. She's anxious. She's not a calming influence. There are many factors that have made that woman behave that way.
So is it fair to say, again, that if you see a woman at a particular age going through some changes or going through some career path, and she's not actually getting to where she wants to be, she becomes a little bit aggressive or something?
I think that's just not fair to say. I think honestly, Ken, if you just peel the layers a little, you don't even have to peel the layers too much, you will often find that women who are going through challenges, either being anxious or having disruption in the workplace or disruption at home, if you peel the layers down, you will often see that there is a physical, biological problem there, as well as environmental, as well as social pressure, all sort of mixed around. And that is
social pressure.
Social pressure, absolutely. All of that brings them to a situation where sometimes it feels as if she feels isolated. She feels like she's the only one going through this, and she feels nobody understands her. So I really don't think that this is something that should be labeled as the aggressive person or the more difficult female, or the woman who is getting towards the age 35 and thinking about her fertility. Naturally, she's hardwired to think of her fertility. And so wanting to settle down, sometimes wanting to egg preserve, for instance, cryopreservation is something that we're having a lot. We're seeing a lot of patients who come.
Do you actually advise that?
Yes, and they do come around, definitely, for many, many reasons. So cryopreservation is something that, not just on a social level, but really, if the woman, say, has had treatments or has underlying problems like polycystic ovaries,
what is that?
Polycystic ovaries is a condition where it's hormonal as well, where they are not ovulating regularly, where their sugar levels are slightly high, where the testosterone levels are a little bit higher, so it makes it very difficult for them to become pregnant. And when you scan, you see so many little tiny cysts. They're actually follicles in the ovaries, which just make those ovaries more resistant. Why wouldn't you want to help her and preserve her eggs? Because these women will definitely have a little bit more difficulty with becoming pregnant in the future. Women who've had breast cancer, for instance, this is October's breast cancer month. If they have been diagnosed with breast cancer early and they are undergoing treatment, so much better to preserve those ovaries and preserve those eggs, so that post-treatment she has a chance for becoming pregnant.
So we will actually get back to fertility and reproduction. But let's understand the brain. The woman's brain, during her menstrual cycle.
Okay.
What really happened in one's brain during this time?
You're so lovely. So I can tell you, the woman's brain during the menstrual cycle changes because of the effects of the hormones. So again, most menstrual cycles are 28 to 30 days. This is the normal length. It can go from 19 to 45, but most is 28 to 30 days.
Is there any, because I've had cases of discussion where
Correct.
someone would say, okay, can I have this irregular menstrual cycle?
Yes.
I have this.
Yes.
I saw my period this month, next month
I missed it. Absolutely. So
what exactly happens in this?
So in that, it's like exaggerated. All the symptoms I'm going to tell you about for a normal cycle become exaggerated. They become worse if that cycle is irregular, because it means that the hormone, that cyclical pattern of the hormones, is also disrupted. So there are 4 main hormones that occur that control our cycles: estrogens, progestogens, something called the luteinizing hormone, and something called the follicle stimulating hormone. So the follicle stimulating hormone and estrogens, they are the prominent hormones in the first 7 days. So when the woman is having her period, just after she's had her period, you will find, let's take it 7 to 10 days. Those are the predominant hormones. Those hormones, they can make you feel tired, headachy, nauseous, make you feel a little bit uncomfortable. There's sometimes bloating, abdominal bloating, and pain. Women have some of the highest pain thresholds because throughout our cycle, we are experiencing pain almost all the time, from the uterus contracting and from the ovaries getting bigger and from the eggs releasing. This is always causing pain. So women learn to live with this pain over the course of their cycle. In the middle of the cycle, or just before they release the egg, that's around day 14, they will get a surge of something called the luteinizing hormone, which makes them energetic. It's natural because anthropology means that they're looking and seeking their partners because they want to be pregnant. So they get happier, much more energetic, and the eggs release, and if it's fertilized, they will be pregnant. If it is not fertilized, those hormones, estrogens, progestogens, progesterone, luteinizing hormone, follicle stimulating hormone, they will all crash. And as they crash towards the end of the cycle, when another bleed is starting, the woman again feels down, because progesterone is a happy hormone, is a lifting hormone. Luteinizing hormone also lifts your mood. And if everything crashes, the woman is going to feel down again just before her period. So it's a very interesting scenario that every day of the year, every day of a woman's life, they are either feeling slightly down, but coping, in pain because of contractions, because they're having periods and the uterus is contracting.
So are women actually wired to, get a lot of pain and resist?
Absolutely. We are hardwired. The evidence is very clear. The research is very clear. There have been many studies done on female pain threshold. And in fact, there are some recent studies of where they've put electrodes on men and tried to mimic period pain, what happens during a period. And the men have not been able to cope with it for even up to 5 minutes max.
Dr. Miriam, please talk to us more about period pain.
Period pain is very interesting. It's a spasm pain. It's a pain that is related to blood vessels narrowing. There's virtually it goes into spasm, and it causes the lining of the womb to shed itself. Period pain is associated with the lining of the womb shedding itself and the uterus contracting. So it's like a spasmodic pain. Imagine the type of pain that you would get if you had a kidney stone, a small kidney stone going through your ureter. That spasm, that squeeze. That's what period pain.
That's the kind of pain women
Yeah, that's period pain. Period pain is spasmodic and painful. There are some women who will tell you, I don't have period pain. I don't feel period pain. I don't feel it. They are getting it, but their pain thresholds are just high. They are getting regular spasmodic uterine pain.
So the question now is,
correct,
doctor, what can men do at this time?
Absolutely. So
they are women.
So it's
sisters.
So it's so interesting. So again, if it is managing the periods, it's all about, just being supportive. When I say supportive, understanding that she's going to be tired. The average blood loss in pregnancy, not pregnancy, but during a period is about 150 mils.
Yeah.
If a man is losing 150 mils of blood, they're going to be anemic. They're going to be feeling
they'll
go to ER. Exactly. This is regular for us.
Okay.
So if she's feeling a little bit tired, or she's feeling a little bit sleepier, or she's feeling pain and discomfort, just would you like a Panadol? Would you, just support, however that support can be, is one thing. And not to distance it and say, oh no, this is just a period. During pregnancy, first trimester pregnancy, this is my big thing. First trimester, the first 3 months of pregnancy is hellish. It's beta-HCG. This is the predominant hormone. The hormone is designed to make women nauseous, feel ill, lose their appetite, lose weight, actually. It is designed really, it's one of the most abrasive hormones women can get in the first 3 months of pregnancy. It's called hyperemesis, or excessive nausea and vomiting in pregnancy. It's a very difficult condition, and it is actually even associated with psychosis. Women go crazy with it. I'm not joking.
I would come in here.
Yeah, it's real.
So you're saying, for the first trimester, there's a likelihood that a woman would go crazy.
There is a chance, a risk, a very small proportion of women who have severe hyperemesis gravidarum will also have an associated psychosis with it, because it is so damaging. It is so difficult. These women need they need admitting into hospital. They need intravenous care. They need lots of intravenous medication. They lose sometimes up to 10 to 15% of their body weight. They do not understand what is invading them. And this is just because they are pregnant. Thankfully, it's a small minority of women, but because of my background, I tend to look after the higher risk women. The famous severe hyperemesis woman is Princess Catherine, Prince William's wife, who also suffered from severe hyperemesis gravidarum. Yeah. Debilitating. It is a debilitating condition, and it actually can cause mental health issues. So it is very well recognized. Thankfully, most women get mild to moderate or none at all, but most women can manage. So support in the middle of the pregnancy. So when they've gone through that and they're feeling better and they're feeling nice and energetic and wonderful, it's great. But just before they are about to deliver, you will also notice changes in the woman. You will also notice a sense of apprehension.
What kind of changes?
The changes are basically the libido. She may lose her libido, not want to be near her partner. She may not want to. She may feel a sense of anxiety with the coming birth, etc. It's a lot of reassurance that women just need around that time. You may notice it's so uncomfortable, it's so painful. She can't walk easily, she can't stand and lift and carry things. These are natural. Men tend to see the physical parts of it very nicely. So if a woman is heavily pregnant, their husbands or their wives, their partners tend to be very supportive because they can see the physical aspects of it. But there is also the internal aspect of it, the fact that her body has to completely change. Progesterone will make the ligaments, the so-called pubic symphysis ligament, totally spread apart just to allow the head to come down. And she can't walk, she can't move.
I'm actually the one, Dr. Meriam.
Really? She cannot move. She cannot cross her legs.
Seated here and listening to you about this whole
Honestly.
I'll tell you, I'm having goosebumps already.
I am so glad I'm so glad, Ken, that you're experiencing this.
And it's very, very serious.
Because I suffered when I was pregnant with both my children, actually. My first child, I was on crutches towards the end of the pregnancy. I was a working senior registrar with crutches. I couldn't walk. I had severe symphysis pubis, diastasis. My pubic symphysis bone had just come apart. It wouldn't allow me to walk. There are some women who are wheelchair bound at the end of their pregnancies because of, a physiological response. This is not a disease. It's a physiological response, but it opens up the pelvis. So can you imagine, without the education, without the understanding, the woman is suffering all of this just before the birth. And then she goes through a birth, hopefully it's a nice atraumatic birth. But if it is not an atraumatic birth, and it is a birth that has left her feeling scarred and stressed and changed beyond anything, you can understand this idea of postnatal depression and sometimes postnatal psychosis. So,
Dr. Miriam,
yeah.
from your experience, what are the biggest medical myths that
Yeah.
men believe
Yes.
about women's pleasure and anatomy?
It's a very interesting one. So, unlike men that are visual, men are very visual. Men are very testosterone driven. So that is the way men are designed. Men are designed to see and desire. A woman cannot see and desire. She can't do that. Very few women.
What can she do?
Her relationship is based on so many things. Does she feel safe with the man? Are her hormones aligned? Does she feel? Is she in that window that I was telling you about, where the progesterone is high, where the luteinizing hormone is high? Is she in the level where all the hormones have crashed and she honestly cannot be near her husband? She can't. In fact, she sometimes your sense of smell changes. So, I've been married for 28 years, but there are sometimes I remember when I was much younger and I was pregnant, I couldn't bear the smell of my husband. And it's not that he's got body odor or anything. It's just the hormones change so much that you really just cannot be around. So there are so many. So hormonal, safety. Does she feel, is there time? Women's anatomy are full of nerve endings. The whole of the female genital tract is nerve ending stimulated. So we are not like men with very few nerve endings. And so if a man does not spend time trying to make their partner ready, she is not going to be responsive. So there are so many different aspects that men just have to understand, that it isn't like them. Women are not visual creatures, and women do not respond in the same way as a man would. They definitely need a little bit of time, a little bit of understanding. They need to be made safe. They need to understand that this person, and also biologically, they are hardwired to want to procreate. And this brings me to birth control and all the problems and damage that birth control can do. It is beneficial, there's no doubt. Combined oral contraceptive pills and all the birth control pills that we have available, I regularly prescribe, there's no doubt, and they have their use, but they also have their disadvantage. And one of their disadvantage is that they completely change this pattern that I was telling you about in women. A woman taking birth control, for instance, may be feeling depressed for almost all of the cycle because her estrogens, her progestogens, everything is suppressed. FSH, LH, everything is suppressed. So she's just behaving. So, partners often come to my clinic and say, my wife started the pill you gave me and she has changed. And I have to explain to them that, yes, she's changed because the pill has taken over her cycle. So she doesn't even get those windows anymore. And I often say that if a man had to take birth control, we would be overpopulated because men would not tolerate the side effects of birth control or how it changes
So
our...
what exactly, from your experience, are the side effects of birth control?
Oh, there are many. Nausea, vomiting, headaches, excessive fatigue, depression, feeling sad, vaginal dryness, loss of libido, loss of sexual arousement. There are so many problems with birth control, actually, which can, and then there are the more serious ones, things like hypertension. It can increase your blood pressure. It can cause blood clots in the legs. It can cause breast cancer if used for more than 10 years. There are so many problems with birth control that women accept.
Miriam, this is like a full lecture I'm having here on the show today.
I'm glad
it's debated.
Honestly, Ken.
But let's look at intimacy and connection.
Yes.
We're looking to wrap up. What's the difference between pleasing a woman's body and understanding her body? Because I think men need to understand this.
Absolutely. So, honestly, I don't think you can have intimacy without understanding. I honestly don't think. I think they're mutually exclusive. I think that a man who truly wants to experience true intimacy with his partner or his wife has got to understand his wife. And when I say understanding, women need a holistic understanding. So all the things that we've been talking about, the hormones, the cyclicity, that is part of it, but also the idea that women need to feel safe, they need to feel supported, they need to feel that this person who they are with, who they call their husband and their partner, actually will be there for them. And I really, really say this with all due honesty, that this is the way women have been hardwired to behave. You will see all sorts of deviations from this norm. So many different deviations in our modern society from this norm, from speed dating to speed this and speed that. It doesn't work. That is not intimacy. Intimacy is a full understanding of your partner, understanding the likes, the dislikes, the physiology of your wife or partner, the understanding of where she is at a particular time, why she is even behaving like that. Honestly, again, I go back to my father. I go back to my dad, and in hindsight, when I was young, I didn't really understand all these clues, but now I do. Better, much, much better. I understood that my father truly understood my mother, truly, truly knew what was right and what was wrong for her. And she, in response, knew that he also knew. They had fights and they quarreled a lot. They were married for 65 years. And
that's
yes, they were married for 65 years before he died. And when I look back and I realize how my father was, sometimes, we always used to say, Dad, you're so quiet. Why is mommy saying this? Why is mommy doing this? And he said, look, don't worry, it's your mom. She's fine. He never, ever critiqued her. Okay. Whatever she said or did, he never critiqued her, at least not in front of us.
Yeah.
And, I would never see their fight ever last beyond 2 or 3 hours. And then it was all over. Because he kind of knew that this was how she was, etc. So I can only tell, that's my personal experience, but the scientific experience really, and the scientific evidence behind women and their physiology and what men need to know about women's bodies is really not just the physicality of it. Almost they have to go slower. Men have to go slower. Men are designed to go faster, be much more driven. Women are actually much more nurtured, so they go slower. And sometimes that pace isn't matched.
Talking about going slower and pace, we can't have this conversation about intimacy and connection without talking about something that when I check it out, I saw that it was like something that was very prevalent.
Yes.
As the fact that, is it true that many women feel discomfort during sex or intimacy, and what should men do at this
about
time?
It? It's a very important question. And again, it goes back to timing, part of the cycle. Where are we? So if a woman is 18 to 35 years old, she's very well estrogenized. She's got a lot of estrogens in her. Okay. The chance of vaginal dryness is very, very small. So she is designed to, the body's designed to regularly meet her husband. There is a really very low chance of her getting vaginal dryness and discomfort. So that when a woman gets discomfort and vaginal dryness between the ages of 18 and 35, you always have to suspect that there may be something inflammatory going on. And I tell my patients, do not ignore it. Come in, get checked. And what we do is we check the woman. We look for any causes of inflammation, from local causes to more systemic causes like endometriosis, pelvic inflammatory disease, all sorts of issues. We even check the husband sometimes to see whether or not there's a problem. So vaginal dryness, 18 to 35, is very rare. Sometimes vaginal dryness can be due to what the woman is taking. So if she's taking some medication, women who are taking medication for hypertension, for instance, or taking medicines for epilepsy, or taking medicines for, or some hormones, this combined hormone pill can sometimes lead to a problem with difficulty and pain when they meet their husbands, when they're together with their husbands. Now, if you look at a woman who is over 35 to 50, for instance, vaginal dryness is almost the norm. It's normal. Women will always get...
If you talk about, the
Yeah.
vaginal dryness,
Yes.
some would say that
Yeah.
the reason why most women actually feel discomfort is because probably there's lack of enough or force.
Time, absolutely. Of course, that plays a role, but I want to assume that the man has been slow enough and has been... And remember, I told you about the fact that female anatomy is highly nerve ending. There are lots of nerve endings, and each nerve ending will need to be stimulated. And so it takes a lot of time for women to experience arousal compared to a man. A man experiences arousal sometimes just by looking. It doesn't happen with women like that. But assuming that has happened, and she's still experiencing discomfort, and she is young, 18 to 35, there is a problem. And those women have to come to someone like myself at Dr. Mariam Awatai Clinic and get checked, and we will check them. Now, older women tend to experience discomfort a lot of the time. And for these women, again, time is necessary. And sometimes adjuvants help, lubricants, things that can make things better and much more easier for them are some things that they have to learn, because this is physiology, this is hormonal. So discomfort during intimacy with women depends on their age, it depends on whether or not there has been time taken to arouse them, and 3, it also depends on whether there are underlying problems.
This is very insightful.
Yes, very important.
Yeah, I will say this. Seated here with you and talking about this, I just feel like I had a very thorough lecture.
I'm glad.
Now talking about age, because we're trying to wrap up.
I'm glad.
How does age actually, impact a woman's fertility? Because we cannot have this conversation about talking about fertility
honestly
and a woman's age.
Absolutely. I'm glad you mentioned it. And again, I know we don't have so much time, so there is so much to say about it. But it is true. Like I said earlier, we are born as females with a finite amount of eggs. It's just approximately around 3 million eggs. It might sound like a lot, but a lot of these eggs are actually atretic. They're not going to ever develop. And every woman, every time they have a period, you're losing these eggs. And as you get older, fertility will decline. The good news is currently we used to think that fertility declines after the age of 35. It actually doesn't. Vast majority of women are still pregnant between 35 and 38, up to 38. And we think that really it will continue right up until age 44. And when women are 44, they will experience a steep decline in their fertility. And it becomes increasingly difficult to produce a good quality egg that is able to be fertilized and to be able to stay pregnant and not end up in a miscarriage. On top of that, as we get older as women, our eggs tend to be abnormal. 10% of the eggs are abnormal, just like the men. 10% of men's sperms are
What
abnormal.
exactly is an abnormal egg?
Abnormal eggs are eggs that have chromosomal or genetic problems. So if a woman leaves pregnancy too late and starts having babies after 44, 45, the chances when she's releasing an egg, it might be an egg that has a chromosome problem, like a missing gene or an extra chromosome, the so-called Down syndrome, the so-called trisomy 18 Edwards syndrome, trisomy 13 Patau syndrome. These problems become a little bit more as we advance in age. So it is important for women to think about their fertility as they get older. And I stress this because our society is one that is driven by our careers. I am a career woman, so I understand, and I do not stand against women in the workplace. But I do think that if there is a chance that you will not be able to achieve your children by the age of 40, 41, it is a good idea to start egg preserving. And we have oocyte preservation techniques. In fact, I would even suggest if you can start egg preserving around 35, it's better, because the quality of the egg at 35 is going to be better than the quality of the egg at 40. And the techniques for cryopreservation are very well established. And this will give the woman peace of mind, such that when she marries, at whatever age, she knows she's got beautiful eggs that will not have the defects we talked about, etc.
Amazing. This is a full lecture. Okay, so I feel like we should have like a part 2.
We need a part 2. There's so much.
We need a part 2.
There's so much
of this
about
conversation, but
because we haven't talked about so much. We haven't talked about menopause.
You know, but
nothing.
What is that thing, on a conclusive note, what
Yeah.
is that thing from experience as a psychologist that
Yeah.
most of your patients should have asked you, but they did not? You wish they asked you.
You're so lovely. I'm not a psychologist, that's number one.
A gynecologist.
As a gynecologist, sometimes I wear many hats, I have to say, Ken. And you will find the more experienced you are, and, you know, the more patients learn to trust you, the more they will open up about so much. So I find, on average, a patient that comes to see me at Dr. Mariam Awatai Clinic with abdominal pain, I will end up knowing about her blood pressure. I will end up knowing about her, you know, ovaries, about her kidney issues, about her father's problems, about her sister's issues, about the cancer risk in their family. There is so much. During the course of a consultation, you will find your patients will open up about so much. But mental health is a real issue. And mental health still remains a stigma, I have to say, Ken. And even patients that are close enough. So I have delivered their first baby, their second baby, their third baby. I've delivered their sisters. I know their mothers. I look after their mothers. I am their family obstetrician. Even in those families, mental health still is very difficult to talk about. And I wish that my patients would understand that, even though I'm not a psychologist and I'm not a psychiatrist, if they are going through these pressures, particularly mental health pressures, they need to talk to me about it, because I can get them the right help. We are in an ecosystem of health. I truly believe that the idea of jack of all trade and master of none is not the idea in medicine. Medicine is becoming more and more subspecialized, and we work in networks. So if I, as a gynecologist and obstetrician, I see a patient who has, say, rheumatoid arthritis, I will definitely...
What is that actually?
Rheumatoid arthritis is a condition where, you know, they've got these arthritic pain, lots of joint aches and pains. They produce antibodies that can cause real problems for them and can affect their fertility because of the drugs that they're taking. So I would refer to my colleagues, you know, coming to see one doctor, we're a bit like the police, we're a bit like the army. So if you come and see one doctor, be sure if you have any other problems, you will get help for all the others, because we are all connected. A good doctor is always going to connect herself to other good doctors.
Thank you so much. But I cannot leave you without you telling men, you know, especially younger men, husbands, fathers, brothers, on the need to actually learn and truly understand a woman's body.
Honestly,
what would be your
parting advice? My parting advice, Ken, having had such a fantastic talk with you, for all those boys, men, fathers, brothers, uncles, grandfathers out there. Honestly, it is so important to impart advice, seek advice. So for the younger ones, impart your advice onto them. Give them some advice. For the younger ones who do not have older peers or older role models, male role models around them, they too have to be knowledge seeking. You have to understand that a woman is not just the physicality that you see. She's not just made of what she looks like. She is much more. She is hormonal. She is cyclical. She is nurturing. She is, I don't know, what can I say? There is the science behind why she is how she is. And you've got to just have this understanding and be patient. Realize that the female and the male gender are different and they were designed for different purposes.
Thank you so much, Dr. Miriam.
Thank you.
If I let you talk, you would talk for hours.
I will indeed.
Okay, so thank you for coming to the show.
Thank you so much, Ken. God bless you.
I think I need to prepare for a part 2 of this conversation.
No worries, more than happy.
I think we need to have another
We do. Because
conversation
we didn't
about
actually
this.
touch on menopause.
You know.
And we will have one on menopause because I think that's
surely
really
do.
important.
We need to have these conversations because these are very important
Honestly.
topics that should be talked
about.
Now,
Absolutely.
if there's one thing this conversation should remind you or should remind us is that understanding a woman's body goes beyond attraction. It's about awareness, compassion, and growth.
Definitely.
So, to everyone listening, don't just admire, understand. If you actually enjoy this conversation and what we do here, kindly subscribe, share, and leave a comment, as your support is really appreciated. Thank you so much. Gracias.